My name is Hetal Lakhani, and we had come here for TAVI procedure for my mother. So she needed a urgent heart valve replacement, and Dr. Rahul Gupta was recommended to us by many of the doctors of his, many of the doctors who said that he is the best to do the TAVI procedure. So we visited Dr. Rahul Gupta around 10 days ago. He did all the pre-primary reports and everything, guided us properly, and after that we conducted the operation 2 days ago for my mother for the heart valve replacement using the TAVI procedure, and we had got admitted in Apollo Hospital on Saturday. Today is Tuesday. We are kind of leaving the hospital now, very happy and very thankful to Dr. Rahul Gupta for helping us out through the procedure. I would like to add that he is a fantastic doctor, and he came to us before the operation also, explained us as to how the procedure will be done, told us, assured us not to worry, and he immediately met us after the procedure also and explained us as to how the procedure went, how well it went. And we had great support from Dr. Anand Zade also, who's the nuclear department or nuclear medicine head in this hospital. So our experience with both the doctors have been exceptional, and we are very happy and thankful for that.
Hi everyone, I am Dr. Rahul Gupta. I am the Chief Interventional Cardiologist at Apollo Hospitals, Navi Mumbai. And today I am going to discuss about a newer technology called as TAVI, which we performed in this patient, Usha. She had presented to me with symptoms of difficulty in walking, breathlessness, heaviness in the chest, dizziness. And when we evaluated her, we found that her aortic valve has become severely narrowed. Now, there are 4 valves in the heart, and aortic valve is one of the most important valve. It regulates the blood flow from the heart to the entire body. And because of the aging, there can be deposition of calcium, and because of the calcium deposition, the opening of the valve becomes very narrowed. And when it becomes very severe, these patients start getting significant symptoms. And in fact, if not treated, then the deterioration is very fast. They start developing breathlessness, episodes of loss of consciousness, heart failure symptoms, and eventually there can be a sudden death. So these patients, once diagnosed with severe aortic stenosis, they need early treatment. Now, previously the only treatment available was open heart surgery. You cut open the chest and you replace the valve. Now, with the advent of this newer technology, which is called as TAVI, you can replace the valve even without making the patient unconscious under local anesthesia. And 98% of the time it is done through the artery of the leg, as we do an angioplasty under a local anesthesia. So this procedure was completed uneventfully. We used the balloon expandable valve. We went through the groin artery, we replaced the valve over there, expanded the valve, and the valve started functioning immediately. And the patient recovered very well. Patient was up and above. There was mild sedation which we gave, but she was conscious all throughout. And she did really well. She had a minor bout of fever which also recovered. Therefore, the stay increased for a day. Otherwise, we usually discharge within 48 hours all these patients. So these newer technologies are changing the way we treat our patient. It is making life much easier for the patients, for the doctors, and we can solve very complex scenario through these minimally invasive technologies. It usually requires a heart team, and so we at Apollo have a very good heart team where we discuss these kind of cases. And then when everybody is consenting to a particular approach, then we go ahead, present it to the patients and their relatives, and then we go ahead with the procedure in a team approach to give the maximum benefit to the patients. Thank you very much.